There's a general guideline to, let's say, people who can't get help professionally. Where do they usually start out? I've read often about a gram of niacin after each meal.
They often will start with too little. They're afraid of using the right amount. So that can be a problem, yeah. But on the other hand, there's some strange things happen. Many years ago, I got a letter from a woman from Denver, Colorado, and she said, "Dear Dr. Hoffer, thank you for helping my daughter get well." I'd never seen her. So then in this letter she says, "My daughter was 16, and she was schizophrenic, and she was told by her psychiatrist that her mother had made her psychotic." This was another old idea that used to be very common, the schizophrenic mother. So the girl said to herself, "If Mom made me sick, I'm out of here." So she went and joined a hippie crowd, and she ran with this hippie crowd. And one day at a local drugstore, she ran across a paperback book called Megavitamin Therapy, written by a New York reporter who wrote about our work. And there she read about niacin and schizophrenia. So suddenly she got, "Oh my God, maybe if I take niacin, I might get better." Now this is kind of funny, because when she told her friend that she was going to take niacin, they cautioned her not to do it. They said, "Don't take that, it's dangerous." Now they were taking drugs and pop and everything else, but they wouldn't want to take niacin. Anyway, so she went home, told her mom, and she went around and couldn't find a single doctor that would monitor her. She saw 12 different doctors. Not one would help her. So on her own, she began to take niacin. And she had read, which is correct, that if you take too much niacin, you get nauseated. So she started taking more and more and more and more. She never got nauseated. Before long, she was taking 120 pills a day of niacin, 60 grams a day of niacin. And when she reached that level, all the voices stopped. So I thought that was a great story. Anyway, I was giving a public lecture in Denver a few years later, so I thought, here, this is an appropriate story. I'll tell them the same story. So I tell them the story in Denver, and at the end of my story, a woman at the back says, "Dr. Hoffer," she says, "would you like to meet her?" She was at the meeting.
Wow.
So she and her daughter came up to the front, and I had a chat with them, and then she now was taking just 3 grams a day, which is a normal dose. She was well. She had taken 120 tablets, 60 grams of niacin a day. Most people couldn't tolerate that. She could, and it got her normal.
And then after her need decreased?
That's right. After she was well, she didn't have to take nearly as much. So I hear these stories all the time. Now, if I were not allowed to use niacin as a part of my treatment for schizophrenia, I'd dump medicine. I'd get out. I'd say to hell with it, because I'm not going to treat patients with drugs just to keep them sick forever.